Hi guys, welcome back. We shall be talking about the allergic rhinitis. Allergic rhinitis is very common. It is also known as hay fever. In allergic rhinitis, in fact, the allergic rhinitis is so common. It is known as the most common chronic disease of the mankind. Okay, the most common chronic disease of the mankind is allergic rhinitis, right? So, what is allergic rhinitis? That means you are exposed to some sort of allergen, and there's inflammation inside your nose. Now, what are the allergen? That means that is going to cause you inflammation. That means your body is having an hypersensitivity reaction. That means your body is reacting way more than normal it should react. Okay. So, what are the common allergens? Now, common allergen is that you can have pollen grains, you can have your dust mites you are having from animals, domesticated animals, or some sort of room fresheners, room spray, or even your liquid vaporizers for mosquito repellent. With that, you have some sort of medication. You might be allergic to some sort of medication, let's say aspirin or OCP, that's oral contraception pills. With that, you are having NSAIDs, NSAIDs, that is a non-steroidal anti-inflammatory drugs. You are allergic to that. Along with that, if you are allergic to some sort of food, now what are this food? Can be any food, can be meat, can be dairy products, can be milk, can be anything. Okay, with that, if you're exposed to some sort of smoke, that is a smoke coming out from the chimneys of your house or your factories, refineries, or even from the gas exhaust. Okay, so these things will might be an allergen to you. See, allergic to you, if something is allergic to you, might not be allergic to me. If something is allergic to me, might not be allergic to you. Why we say allergic? That means your body is hyper reacting. It is known as hypersensitivity reaction. That means your body is overacting to that allergen. Okay, it is acting more than normal it should act. This is known as hypersensitivity reaction, right? So what are the allergic rhinitis is divided into two parts. Okay, so division of allergic rhinitis is two parts. Is known as seasonal and non-seasonal. Now, seasonal means this symptoms will be present during a specific time of a season of a year, and the non-seasonal means these symptoms will be present throughout the year. Right now, why seasonal? That means seasonal means mostly it is associated with pollen grains. People who are more susceptible or allergic to pollen grains, they are mostly having seasonal allergic rhinitis. That means whenever there is seasonal, that means there is a lot of wind blowing. That means even the pollen grains are blowing. So people who are allergic to pollen grains will have this allergic rhinitis. So excess amount of wind will cause this pollen grains to fly all over here and there, and people who are susceptible to allergic rhinitis due to pollen grains allergy, they'll have this allergic rhinitis, right? And so how will you know that you are having allergic rhinitis? These symptoms are very common. Okay, so everybody actually knows that what is my allergen, because you have to find out that what is the thing that is causing an allergy. Because let's say you have eaten something and you develop an allergy, so you know that okay, I was cleaning my room today and I have an allergy today, right? I went out in the public without I had a lot of dust exposure and I'm sneezing a lot. So you know the allergy, or I ate this kind of food and I am having this allergy. So you have to find out. It is common and it is easy to find out because you know your body the best, right? So you can find out what is the allergy for your body. Now, talking about how will you know that you are having allergic rhinitis, there are some symptoms. Now these symptoms are very important that you should listen very carefully. The symptoms are that you will be having itchiness. Now itchiness will be present on your throat, maybe on your palate or in your eyes. Along with this, if you are having bilateral nasal congestion, that means both of your nostrils are blocked. With this, you are having watery rhinorrhea. That means watery discharge. Now, this color of discharge will be water-like, and it will be non-sticky or maybe very less sticky. And the fourth thing is that you will be having special kind of sneezing, that is known as multiple number of sneeze in one episode only. You will be sneezing like continuously 15-20 sneeze in one setting only. So out of this, if you are having two symptoms or more than two symptoms, and these symptoms last you for more than an hour, and this are present in most days of a week, then you say you are having allergic rhinitis. Again, this is important that you should understand. I'll repeat it again. Itchiness on your throat, on your eyes, on your palate, you're having nasal decongestion. Remember, nasal decongestion in both the nostrils, watery discharge, and you are sneezing multiple times, that is 15-20 times. And this out of this, if you are having 2 or more than 2 symptoms, and this symptoms last you 1 hour or more than 1 hour, and this is present in most days of a week, then you say that you are having allergic rhinitis. Okay, so now you know you are having allergic rhinitis. Now what to do? Okay, the main thing, what to do now? The best treatment is that you should avoid the allergen. If you are allergic to dust, do not go and expose yourself to dust. You should keep your rooms clean. Or if somebody is cleaning your room, do not enter your room. There will be, like, when you're cleaning your room, there is a lot of dust. Okay, if somebody is smoking, do not go near it, because you might be allergic to smoking. Along with this, if you are having liquid vaporizers, don't. If you are having due to some food, manage your food, and some sort of medication, talk to your doctor. So the first treatment is to find out your substance or the object that you are allergic to. Okay, then with this you can take antihistaminic tablets. Example, you can take fexofenadine hydrochloride. Along with this, you can use nasal decongestion, but preferably please try to use saline drops. Okay, saline nasal drop. There is no side effect of saline nasal drops. Nasal decongestion, it can have some side effect to some people who are having diabetes, or people who are having some sort of heart disorders. They can actually become complicated. So saline water is very good. Along with this, you can take antihistaminic tablets, but again I will tell you, main treatment here is that you should please avoid the allergen in the first place. Okay, so that's about the allergic rhinitis. It's very common, and sometimes it becomes very irritating for the patient. And that's all for allergic rhinitis. I'll summarize it again. It is very common. Remember the symptoms: itchiness here on your throat, on your palate, on your eyes, congestion on both the nostrils, watery discharge, and you're sneezing multiple times, 2 or more symptoms. And if these symptoms last you for 1 hour or more than 1 hour, and these symptoms are present in the most days of a week, then you say you're having allergic rhinitis. Please watch out for the symptoms. Watch out for the allergen that you are actually allergic to. Maybe pollen, maybe dust, maybe some sort of food, or maybe smoke, your tobacco smoke, your even sometimes from your domesticated animals. And the treatment is that you remove the allergen in the first place. Along with this nasal decongestion, you use saline nasal drops. With that, you can use antihistaminic tablets. So that was about allergic rhinitis, and that's all for now. If you have some any other suggestion that you want to then you can talk. And investigation of allergic rhinitis is actually not very required, because it's very easy to diagnose that you're having allergic rhinitis with just the clinical history. Yes, now if you want to go to one step ahead, then yes, you can do that. If you do a complete blood count, your eosinophil count will go up, because whenever you are having any allergy in your body, your eosinophil counts go up. At the same time, if you do your nasal smear, that is if you do your nasal smear, that means you take the nasal secretion and place it on a glass slide and watch it under the microscope, you will see more number of eosinophil cells. Along with this, to find out what thing that you are actually allergic to, we have a test known as skin prick test, in which we will expose you to different types of things, maybe dust, maybe grass, maybe some sort of food, and all this. We will try to find out what is the thing that you're actually allergic to. But most of the cases, people, they themselves know that I'm allergic to this object or this specific item. So that's all for now. And allergic rhinitis is common. You can manage it, remove the allergen in the first place, and you're good to go. Thanks.